Our friend is tagging us here because she knows that we have a podcast that's focused on obesity education and advocacy. I'm going to work past my own bias and choose to think that you actually do want to know about this and be educated, and that you're not just saying some things that are in the news to try to get more clicks and views. I'm going to choose to think you're genuine. So I'm going to try to explain this in less than 3 minutes. First, if you go and listen to the first podcast that we have Dr. Albert on, who is an obesity specialist, and he discusses how type 2 diabetes and obesity are the same biological dysfunction, and how they have learned so much over the past 20 years about the disease of obesity and about how GLP-1 medications can help treat this and help save lives of people who don't have to die. He talks about how obesity isn't our fault, how it's not a choice, and how being on these medications can help us choose to have a different lifestyle and enable us to do so, which it does. There are people that mistreat this medication, but that's true for all medications. Did you know that Ozempic is a GLP-1 medication that's been on the market about 5 years, but they have a sister medication, if you will, called Wegovy, and that one is actually approved specifically to treat obesity for people with high BMIs. Did you know it's the same medication? It's called semaglutide. In our country, they can rebrand things when they get new designations, and it also helps them extend their patent and charge more money. It's not the first time this has happened. Have you heard of a drug called Victoza? It was originally used to treat type 2 diabetics. They then rebranded and created a new product called Saxenda, and they got it approved to treat obesity and help with weight loss. That drug, Victoza, has been in the market for 10 years. We actually have 2 decades of data on GLP-1 medications. They're not as new as people try to make it sound with the sensationalism in the media. People with obesity just want to be able to live normal, healthy lives. We want to see our children grow up. We want to have grandchildren. We want to have dogs and friends and go out to eat and not cry because we don't fit in or we feel like we are fat and lazy and worthless and useless, which is what our society tells us. For many of us, this medication has unlocked a whole new side of things. For example, considering nutrition and being able to make choices, because the medication quiets the noise, the food noise that's in our head that's always telling us that we need to eat, consume. So our brain is free to focus on other things. We like to move more because we lose weight and we feel better. That age-old eat less, move more clearly doesn't work for everyone, or we wouldn't have people that are obese. There are people out there who can eat whatever they want and not exercise and never gain a pound. The exact opposite is also true. All bodies are different.